Hello, Dr. Craig Childress here. This is my foundation series. Welcome. We are moving into an analysis of attachment-related pathology surrounding divorce using the family systems information sets. Before we enter into the family systems literature, I want to ask a favor of everyone. I want them to take that construct of parental alienation. There's an idea termed parental alienation, and I want you to take it out of your brain. Okay, I want you to remove parental alienation from your understanding and to approach the clinical understanding using the information sets of professional psychology. Now, the term parental alienation was coined and developed within forensic psychology, court-involved practice. I'm a clinical psychologist. My career is spent in clinical psychology, which is the assessment, diagnosis, and treatment of pathology. Forensic psychology is limited to anything that's court-involved. It's more of a procedural rather than a content field. And in their efforts to sort of manage the pathology that they didn't quite understand, they coined a new form of pathology they call parental alienation. Now, the construct of parental alienation does not exist in clinical psychology. And I want to emphasize that point to everyone by going back to some of my foundational books that I received as a postdoc or that I got early in my career as I entered into the field of child and family therapy. So as a postdoc, you're working with your supervisor mentors, and you are assigned certain books, certain sets of information to read and acquire. And one of the foundational books we were assigned at Children's Hospital was the Children's Needs books. And you see developmental problems and alternatives. And this is a big, huge book about all the different types of issues facing parent and child relationships. So, for example, we have a chapter here on psychological and physical abuse. We have a chapter, let's see, here, on adolescent pregnancy and parenting. So just a whole range of the type of things that we will just find in parent-child and family pathology. So just take a look quickly at the table of contents here. You'll see things, like child's social needs and develop social competence, and then over here, children's emotional needs, developmental problems, self-concept, loneliness in childhood, stress, anxiety, and so just a whole range of issues here. Let me pull over this one. So we have family organization and practices, children's academic needs, so motivation and learning, and so children's needs. If you need to know anything, this is the book you go to. Now, interestingly, there's no mention of parental alienation anywhere in this book. It's not recognized or real pathology in clinical psychology. Nowhere in here does it talk about parental alienation. Now, other versions of these types of compendium books are this one, Treatment of Childhood Disorders. Okay, and this one is more DSM based, and so you can see on this we have behavior disorders, emotional and social disorders, developmental disorders, health-related problems. And so it basically goes along the DSM lines of the different types of pathologies that are there. Another book is the Clinician's Handbook. Now, these are all from my garage. I just went out and grabbed them. Integrated Diagnostics, Assessment, and Intervention in Adult and Adolescent Psychotherapy. And so, again, this is a resource book. Again, sort of organized around the DSM. We have substance use disorders and the schizophrenia and the mood disorders. This is more heavily DSM oriented. So we have anxiety disorders, somatoform dissociative. And so this is a sort of a comprehensive source book describing all the different pathologies. In addition, as a clinical psychologist, we go to our sort of general source books for therapy. And so here we have theories of psychotherapy and counseling. And so you would have your various, this is where it describes the basic schools of psychotherapy. So there you see the theory, psychotherapy, and counseling. And so general theories. And then we go into psychoanalysis there. And then Jungian analysis down to the Adlerian. That's all the psychoanalytic kind of models. And, person-centered therapy. Over here, the existential therapy there. So, Gestalt therapy, behavior therapy, and rational emotive therapy here. And, there we go, cognitive therapy down here, number 10. Chapter 11, we got reality therapy. These are all the cognitive behavioral stuff. And then over here in chapter 13, we have family therapy. You see right here Bowen's intergenerational approach. Structural therapy, that's Salvador Minuchin. Strategic therapy, that's Jay Haley and Chloe Madonis. And then other family therapy in there. And so this goes through all the different types of psychotherapy, Asian therapy, body therapy. Now, interestingly, you will look through this book and nowhere will you find any description of anything called reunification therapy. There's no such thing as reunification therapy. It doesn't exist. And I know it's used. I know it's used a lot in forensic psychology, reunification therapy. But they're just making it up. There's no such thing as reunification therapy. There's no such thing as parental alienation, which is somewhat unfortunate because then they get lost when they start to describe new forms of pathology and new forms of therapy that they're just kind of making up wholesale. Another one of these resource books is a comprehensive guide to child psychotherapy. So there's all the psychotherapy approaches, and then something like counseling children as well. And so in all of these source books, resource books for professional psychology, none of them discuss parental alienation. Not a single one. Because it doesn't exist in clinical psychology. It's a forensic psychology thing that they made up over there in the court-involved practice. And it's a really problematic construct. It's poorly defined. So as we enter into clinical psychology, I'm going to ask everyone to take that term parental alienation out of your head and put it aside, put it up on the shelf somewhere. You can always go back and get it if you need it, but for right now, just leave it behind because we're going to be entering the world of established clinical psychology and the information sets from established clinical psychology. And we'll be starting with the information sets out of family systems therapy. So follow me along to the next video and we'll begin to open up family systems therapy.